Welcome back, team, to Plastic Surgery Untold. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon, and I'm excited to have our celebrity guest, Dr. Scott Hayden, joining us today to talk about breast revisions and secondary breast surgeries. Just so you guys know, it's not just revising all of our own surgeries. We do a lot of good work around Austin and helping others and so forth. But we also have our usual suspects with us, formerly known as Austin's most eligible bachelor, one Gilberto Signs.
Formerly.
And then we also have Megan Blue Checkmark Parkin.
Hey, guys.
Also known as Just Megan. And then, of course, celebrity husband who's got to catch us up on a lot of thrilling adventures since our last cast.
Oh, yeah.
But before we get to all the gossip and treachery and other mishaps, Dr. Hayden, can you let us know a little bit about you and why you're known as Westlake's most famous plastic surgeon?
Well, thank you for having me. I was fortunate to grow up in the Austin area, attended Westlake High School and then University of Texas, went away, did my training, and then came back in 2002. So I've been practicing here in Austin for about 18 years and proud to do what I do.
And I don't think a lot of people know. We actually operated at one of the same surgery centers, and that's how we, I think, became pretty close. And we actually pretty frequently discuss cases with each other to go over things.
Absolutely, and I think that's very important because with plastic surgery, if you've listened to this podcast, there's not only a whole lot of topics and procedures, but there's a whole lot of different techniques and ways to do things. And I think that one of the things about it is knowing different ways to do things so that for certain patients, you can give them the best procedure and have the best outcome with the fewest risk of needing revisions.
Exactly. But before we get into that cliffhanger, I think some people have been blowing up my DM about trying to catch up on a few things. And so, the question's always whether to start with Travis's world travels or why Gilberto's not the most eligible bachelor in Austin anymore. So can you catch us up where you're at? You were just taking stuff slowly, quotation marks for those of you listening, with your new love endeavor. Where does that stand right now?
I mean, I think we're still moving slowly and just kind of.
Well, what does that mean?
I mean, I don't know. It's like, we're just getting to know each other again. And
does that mean you've bunted and you're still running to first base, or what's going on here? Can we say that? Is this a PG?
Are we using sports euphemisms now? I thought this was a family show.
Well, nothing news happened. You guys last time you guys were just Netflix and chilling. Megan was unhappy that you don't actually take her out into public and you just order DoorDash all the time.
No, that's
How
not
did
even true.
Valentine's Day go?
Oh,
That was kind of the
that's a
last
good-
thing
yeah.
that was going on.
Catch us up, little Valentine's. What did you guys do for Valentine's?
Okay, so Valentine's, I asked her what she would like to do. I had intentions of making plans to go out to dinner and the grand endeavor and whatnot.
But
and
were these offers made on the Thursday before Valentine's?
No.
Okay, I'm just clarifying.
They were made weeks in advance.
Okay.
But I kind of wanted to get her, her idea of what she wanted to do, what she wanted, what she felt comfortable doing or whatever. And I asked her, and she's like, honestly, I just want to get like pizza ordered in and just hang out. And
That sounds like a trap, Megan.
No, I don't think so. Again, I think Valentine's Day is a little overrated.
yeah.
So I think, just spending time together and being at home and like.
I will
But
say
that's
this.
smart. That's
Hold
smart
on.
by Gilbert because he kept it on the DL.
I will say-
that's
I will-
why he's
He
not
also-
out in public.
No,
he's not
no, no.
showing this off. It's like,
But
damn.
but he did ask. So
Yeah.
if she really wanted to, she would have
Yeah.
said she wanted to.
And I would have made plans.
Right.
But I will say that I did surprise her with tickets to a show that for an artist that she really, really likes.
There you go.
That's
Yeah.
thoughtful.
So you should have a pizza and a show.
Yeah.
Basically Netflix and chill again. You're
Disney
consistent.
I mean,
Okay, so
if
we're
anything, I'm consistent. I guess.
so this is going well, would you say, or
I think
where
it's
are you
going
at?
well. Yeah, I think it's going well. I mean, we're just enjoying our time together.
I mean, to the point where we can officially say you're no longer Austin's most eligible bachelor, because I feel like it can only go slow so long before you're
Yeah.
taken off the list. Is
Yeah.
this?
I guess. Yeah, I'd say.
Wow.
Yeah.
You heard
Wow,
it here
it's a-
first.
Yeah.
people.
Official.
Wow.
Official.
I mean, yeah.
Okay, so,
I'm giving up the crown.
Well,
of
if
Austin's most
you
eligible
think that you deserve the crown, hit us up, and maybe we'll have to crown a new most eligible bachelor. So boom, boom, boom. We'll see what happens. Travis, talk to us a little bit. Last time you were, I think, gonna go skiing, do something, little adventures. How's that going?
Not well. To answer concisely, we went skiing. We went to Breckenridge, Colorado with some friends. We had a great time for the first 24 hours we were there. Second 24 hours.
Yes, we're just taking it slow.
just taking it slow. Mary was doing a lesson, ski lesson with one of her friends. They were
And
out
Mary,
on the
for people
slopes.
who listening
Yeah,
for the first
that's-
time because they're
that's
just
my
Dr.
wife.
Hayden's fans.
That is my wife.
Mary's your wife and also known as Megan's nemesis.
No,
Not
no.
exactly nemesis, but they're both in the same influencer space.
Fighting
Um,
over that space.
That's
Mhm.
right. My wife at Your Trendy Therapist, if you want to check her out. She was out with one of her friends. They were skiing. It was late in the day. They were on a steep blue. She was doing really well with the lessons. He decided to take her to something a little bit more treacherous. They were heading down the mountain. She got all wrapped up in her skis, tumbled down. I get a call. I'm on the other side of the mountain. I answer. I'm on the chairlift going up. Hello? Hey, where are you? She's like, I'm in the back of the sled. I'm headed down. I'm like, whoa, what? And she's like, yeah, I'm in the back of the sled. The ski patrol's taking me to the bottom. I think I broke my leg. I'm
Oh
like,
my gosh.
are you joking? She's like, no. I'm like, "Oh, shit." So anyway, I race over to the other side of the mountain and go down the bottom. She ends up having an ACL avulsion, tibial avulsion fracture. We get back to Austin. Week later, she has surgery. She is now non-weight bearing on her leg for 6 weeks. So it's been
Wow.
rough at our house at the Osborns.
You see what? This is why you're still married, because I would have been like, what am I going to do right now? I might as well take a few more trips down the
Right.
mountain. You know, by the time she gets an
I-
X-ray,
I love-
somebody sees her. There's not really a lot for me to do right now.
I love that when we got home, one of my buddies' first question was, well, did you ski the third day? Like, dude, no, I'm not going to ski the third day. Like, well, dude, she's just got to hang out in the...
There's
She's gonna
not.
hang out in the
I
cabin
agree.
anyways.
There's not much to do. Not
No,
much
yeah.
to do.
He's clearly not married. So.
Scott, what about you? What's going on in your life? I know with 3 kids, didn't you just recently go to like a world cheerleading competition?
I did. I am an official cheer dad. I don't do all the face painting.
Okay.
But I'm
Flip some
very
hair tie?
knowledgeable about it. Yeah, I don't go through many cans of hairspray. I was at nationals watching the Westlake High School cheer team, and my daughter's a sophomore on it, so it's pretty fun.
And how'd they do? Didn't they do rather
Well,
well?
they won last year. They were national champs, and she was a freshman, and she was determined to win every year, but they did not win this year. So, but
wow.
they got to nationals, so that's pretty cool.
I mean, that's pretty amazing, though.
Oh, yeah.
I mean,
Impressive.
I don't
Yeah,
think people
my,
realize just to get to nationals.
My
is-
oldest daughter was a cheerleader, and she actually cheered her first year at Texas, and so my wife has been going for 7 years.
Wow.
And I've never gotten to go because I was taking Ella, my littlest one, to cheer competitions that same weekend. So I'm sitting there streaming it on my phone, watching it at Disney, and this year I finally got to go. So
That's awesome.
very
That's really cool.
Megan, what about you? I think you've been traveling the world a little bit
I
and,
have.
and doing some pant lines or something like this.
Yeah, I opened my vintage denim company, so I've been selling and we've been doing kind of custom stuff through Instagram. It's been a little crazy though. Kind
Just
of
so you
going
guys
back
know,
and
we've
forth.
all gotten a free set of denims, and so you will be seeing that a little bit later of
Custom
the
fitted.
4 of us in skinny jeans. And so, you know,
It's a
you may or
scary
may not
thought.
want
I
to
don't
turn
know.
off the video section for that. But
But yeah, I've been working on that and just kind of trying to figure out how to do it all myself, basically. Maybe trying to hire my sisters in when she wants to help, but I mean.
so
far
is
it's just
this
me.
for men and women? Is this just a women's line?
Yeah, it's men's and women's.
I
Mhm.
mean, so I'm not gonna say that we probably should have a pair to try out, but I
I
mean, you know, but maybe.
Yeah.
I
no
mean,
cutoffs.
No
No.
cutoffs.
Wait,
I mean,
I
I
wanted the
think I would
cutoffs.
look.
It is about to be spring. and
Travis
summer,
does
so-
love some capri jeans. Do you? If
I
you have
do.
some
Hey.
capri denims, he would.
They'll probably fit me like regular jeans.
well, since I know people want to get into and hear some of Dr. Hayden's expertise, let's jump into it. Let's talk a little bit about secondary breast surgery and a little bit of revision type surgery stuff. Do you maybe just want to tell us a little bit what we're talking about, what's encompassing in that? Because I think sometimes people get confused that revision means that somebody necessarily had a problem, but that's not always the case.
Sure, no, very much so. A lot of times, well, first of all, there's a lot of different breast surgeries we do. Some involve implants, some involve lifts, some are reductions. So, and sometimes we combine. We do a lift and a implant, for example. And so, just the natural aging process, the skin gets thinner. We lose our elasticity. We may lose or gain weight. Women with their breast, in particular, when they're younger in their 20s, 30s, etc., it's largely a glandular structure. As they get older, it becomes replaced a lot with fat. And so the makeup of the breast changes. And so if someone has had surgery, for example, in their 20s or 30s, and now it's a decade or 2 decades later, they're going to obviously have some changes that occur. And so revision surgery is really a lot of times to address just natural changes that have happened. when we operate on people, we make it very clear that we're not doing anything that necessarily is setting them up for additional surgeries, but we do make it clear that, in the future, as you age, your body may change.
I feel like a lot of natural secondary surgery stuff is, people will get an initial breast surgery maybe in their 20s, have kids, and then after they're done having kids, send the last child to college or something. They come in for either the mommy makeover or something else, and the breast maybe have fallen after weight loss, breastfeeding, children. And that tends to be a ton of the secondary breast surgery stuff I tend to see.
Absolutely. And I think that, women's outlooks change, the way they perceive themselves change. And so somebody, for example, who's younger in their, 20s, they may want larger implants, for example, and they want a larger breast and they want to look a little bit differently perhaps than they do when they're in their 50s. And that, I'm not putting every woman in the same category, but by and large, that happens a lot. So we'll see somebody, for example, that had fairly large implants placed when they were in their 20s, and then now they're in their late 40s, just like you said, they've had children, breastfed, etc. And now they really don't want quite that volume, and they want to be a little bit smaller. Austin's a very fit town, as you've talked about on the podcast a lot. And a lot of our patients in this area, they want to run, they want to exercise, they want to go to the gym. They still want to look cute, and they want to be able to wear their workout outfits, but they don't want to be as heavy and full, with their breast.
Do you mind if we jump into some few specific stuff? Because one of the ones that I see a lot of people coming back for is actually just wanting to switch from saline to the new cohesive gummy bear implant. And most of the time, they want to change that. The other thing that I see most commonly is people want to change their implant sizes. And so maybe we can talk a little bit about those two and how you address that, or if you've seen that in your practice as well.
Sure. No, I think that a lot of the people, like you said, that have had saline implants, they realize now that the newer implants just look and feel so much more natural, and they didn't have that option perhaps at the time. And when it was 20 years ago, they felt like it was not as safe an implant, and so they defaulted to saline. And maybe their surgeon was even the one that suggested that, because there was a time where in the mid 90s and late 90s, people were not doing silicone because of the scare. Well, we've figured out that now the technology has changed. The shell of the implant is so much more durable. It doesn't break. We don't get ruptures like we used to. But most importantly, the gel on the inside is very cohesive, like a gummy bear, so it doesn't leak out.
And that's where the nickname came from, gummy bear. And I think people get confused, right? Because if you were to actually cut these highly cohesive gels, the gel sticks together, and where the nickname gummy bear came from.
And
Absolutely.
to break it down for people that aren't familiar, a saline implant does not have a gel inside of it, correct?
Saline does not have a gel inside of it, but I think a lot of people forget that both saline and silicone implants have a silicone shell.
Yeah.
Okay.
And so sometimes, and this is where as Dr. Hayden was taught, it's our job to educate people about this, because sometimes people don't want any silicone in their body, and then it's a little bit of a conundrum because there is still the shell, which is made of that same silicone.
Yeah, and I think one of the great things about people who come in that have saline implants is that we have the ability to deflate their implants in the office, because, as I was mentioned before, if it's 20 years later, a lot of times women don't really know what native breast they have left. And so with a tiny little stick, you can put a little bit of local anesthetic, make the skin numb, put a little needle in there, and you can aspirate all the fluid out very safely. And then women get an idea of what their actual breast is like. Then they can decide, maybe I want a little smaller implant. Maybe now I just want a lift. Sometimes we'll combine doing a lift with fat grafting for those that really don't need the volume that the implant would provide.
And I think this is super interesting, because I think a lot of times when people think of revision or secondary, that it's because somebody had a problem or something. But that's not the case for the vast majority of secondary breast surgeries that we see. Some of this is just time and age. And it's interesting because a lot of people, and this is where the benefit of coming to a board certified plastic surgeon that has a lot of experience in this, because a lot of times they know where they want to get to. They don't know the best road there. And this is where deflating the implant, some of these little tricks in your back pocket really help guide patients. Don't you think that's what separates, going to an experienced surgeon or not?
Yes, I think, again, you can't be sort of a one-trick pony. You've got to be able to do a lot of different things.
We tell that to Travis all the time in terms of anesthesia. It's like, just put them to sleep, wake them up. Same thing every day.
That's right. That's me, the one-trick pony.
But another thing that I think in particular is in terms of technology and tools, we have the Vectra system, which allows patients to have a picture taken, and a simulation is then done where we can show them with various implants kind of what they would look like. We can show them what a lift would look like. A lot of times people get concerned about the scars, for example, and a lot of times when you're doing revision surgery, you need more exposure. You're oftentimes doing a lift, and they're kind of not sure why they have to have additional scars on their breast. And so it's important to be able to understand and communicate that to people. So not only the software that the Vectra shows, but also just before and after pictures to show them what the scars look like and how they do fade. And,
And just for like a terminology sake, so if you've had a breast augmentation, you come back to do something else, is that by definition a revision? Or how does that fall under what category?
I mean, that's why we use the term secondary. A lot of times it's a secondary, and revision's kind of broad because we definitely have people who come in and say, hey, I love my breast. My friend has gummy bears. They feel so much better than mine, because one of the knocks with the old saline implants was that they were just really hard and firm. So there's not technically anything wrong. It's just, there's a lot of times nothing wrong with my iPhone. I just want the newer one.
Yeah.
Well, and I think the other thing about the saline implants that people also don't understand is that there is a higher capsular contracture rate with saline implants. And that expression, capsular contracture, means that the normal scar tissue that the body forms around the implant, because your body says this is a foreign body, it's not part of you, we're going to put a scar tissue around it. We call that a capsule. So whether you have a pacemaker, permacath, no matter what you have, artificial knee, etc., your body is forming that scar tissue, and it's only when it becomes abnormally thick or firm that you develop a contracture. That process takes place over months to years, and so women don't often understand that this firmness that they have is not normal, but it is more seen in saline implants than it is certainly with the newer generation of the silicone gel gummy bear implants.
And I think people get confused because they think all capsule is bad, but that's not true. I mean, you need some capsule to hold that implant in place, or you have the lateral displacement, and it's the exact opposite. You're coming back to us and we're trying to do some internal bra stuff, some different mesh stuff. And then there's even some cool things that I've learned from you in terms of doing some various mesh stuff for either supporting an implant or to prevent capsular contracture, correct?
Yes, and I think that, we used to, just like with antibiotics, we sometimes would save the biggest guns for the worst cases. And now we found that if we treat people aggressively with antibiotics with bad infections, we really have a lot better chance of getting them well more quickly. And I think that when we started looking at the breast cancer reconstruction world, and we were using various things like Alloderm, what we call dermal matrices, that has now been used on the cosmetic side. And so I'm much more likely to use a dermal matrix mesh type insert if someone has had a capsular contracture on a new implant. So for example, we know if we put the implant behind the muscle, our contracture rate should go down. We know that if we have the newer silicone gel implants, our contracture rate should go down. And we know if we don't use a very big size and a huge implant, again, our contracture rate should go down. If you've done all those things and you developed a contracture, you've kind of, you got bad luck. And so I'm much more aggressive about saying, look, I really think that you're better off doing this, because one thing that does not get discussed is it's expensive to have a revision. And I think the take home of this thing today should be get it done right the first time, because this is not just a short-term thing. This is a long-term thing. And you don't want to go in because your girlfriend had 550cc implants and you're this tiny little thing and now you've got these implants. You are not going to age well with those implants. And so it's very important that you have the discussion with your surgeon, that you're very realistic with your expectations, and that you feel like the surgeon is comfortable with what you want to do as well. If somebody comes in with pictures and says, I want to look like this, I'm like, no, I don't feel like I can give you what you want.
Right.
That's my out.
And this is one of the things that we've talked about social media before, is that I think sometimes people have these unrealistic
Right.
expectations from these pictures. And while I think they're great for exactly this conversation of what they perceive, because I've definitely had people bring pictures of, I want something super subtle and natural, and then it's right off of a porn site. I'm like, damn, those are nice, but that ain't subtle. And so, I
Right.
mean, how do you feel social media has changed kind of people's
Oh.
perception of what a quote normal breast looks like?
Definitely, yeah. And even to get into it, to have photos that maybe aren't completely representative of what that actually looks like. I mean, it's so easy now to manipulate photos and stuff. It's difficult to bring in a picture and say, this is what I want to look like, and then have that apply to your own body and also just in the real world as well.
Gilberto's brought a lot of pictures off his Tinder app before he was taken off the market, and we've had some discussion of different, pros and cons of breast stuff. We should have had you bring some of those for Dr. Hayden
I
today.
wish I would have
But
prepared
I guess
better.
you had
Oh my
to,
God.
but you had to get rid of your apps now that you're taken off the market.
Yeah.
So
Yes.
Clearly.
or else we would have had some to show you.
Okay.
I think that's kind of because I don't want to lose the point that you brought in about where patients sometimes have this idea that you can just do an extremely large implant in place of a breast lift. And I feel like that's another place where I do a lot of breast revisions, where somebody went somewhere, it was cheaper to just get a breast aug. They avoided the scars, again in quotation marks, by just getting a huge implant. Do it for about a year. Now they don't have the breast look that they wanted. They got implants that are too big. They're too heavy. They've led to some problems. And
They have to
now
do it all
they're
over
paying to do
again.
it all over again.
And I think we've spoken about this a couple times on the podcast too, about doing something right the first time, making sure that you're with a board certified plastic surgeon, and finding somebody that is going to be open, honest, and candid with you as a patient about what you can expect, what are my options, what can we look at, moving forward together. Because like you said, it's expensive to have a secondary revision or a secondary breast surgery instead of just having it done right the first time, because maybe somebody led them astray with, oh, you don't need a lift, you just need monster implants. Not always the case.
Right.
What do you Tibby, tell patients when they come in and they're afraid of a lift? Because one of the things that I like to show them before and after pictures, and maybe you guys do a little bit better job in Westlake than we do at our practice, but it's hard to get people to come back just for post-op pictures outside of 3 to 6 months, unless they're coming back for a separate procedure. Most of the time at that point, people feel pretty good, and we're a little bit of a distant memory for them. And because I don't think most people realize incision scars get better for a full year, especially on the breast and tummy tucks and those things.
Yes, I think that what we try to do in terms of the educational process is when we take pictures, we particularly look at the lateral view. We indicate to people that the crease or the inframammary fold that's underneath the breast is sort of what our landmark is with regard to where the nipple position should be. We explain that that's the bottom shelf of where an implant would sit. And so when that implant goes in, if the nipple position is below that crease, then they're going to have a lot of fullness at the top. Then the breast is going to basically hang off of the implant. So you'll hear people talk about Snoopy deformity or the waterfall effect, which is where the breast kind of falls off the implant. And so when they understand that part, and again, particularly, I think the Vector 3D imaging is helpful because they can see themselves and not just a before and an after of somebody else that looks like them. So I think that that's one of the things that goes along with it. But again, when someone comes in, perhaps they don't really appreciate why you're explaining to them that they now need an implant in addition to their lift, because a lot of times people have just had this deflation of their breast and they really don't have enough substance underneath there to shape the breast once you lift it. And so a lot of people, particularly my practice, I mean, I take care of a lot of moms basically, and so they want to be conservative, they want to look natural, which again, like you said, the word natural to some people is really different. But they
blue check mark Megan may have a completely different natural appearance. I mean, it's like
they need
triple D's are not natural. I thought that's like baseline. That's like triple D is the new B. It's like
being able to explain to somebody how you measure their base diameter of the breast and that the implant basically has to fit that diameter. Then they kind of get to understand. I tell people it's like shoes. If you wear a size 6, you can't wear a 4 and you can't wear an 8. You can kind of cheat half sizes, but they a lot of my patients don't want the look of too big and too full. And once you explain to them, look, let's just say I normally do 350 with a lift. I'm going to put in 250 on you. I'm going to do 30% less than I ordinarily would do. And you show them that implant, and then they get it. Then they kind of understand, okay, well, I'm not going to be that mom that walks into, parent-teacher conference, and everybody's like, good Lord, who did that?
And we've even had patients in my practice that wanted a little bit more over-the-top look, and sometimes you have to be upfront and like, hey, if that's really your end goal, either one, that's not something I'm ever comfortable doing, or two, sometimes we have to break stuff into stages, and I've had people break it up where we'll do either just an augmentation or just a lift and then come back and do the implant, again, for a safety thing, because, while I would consider that secondary surgery, it's not a revision because we have a plan, and the plan is not to kill your nipple, not to cause a bad problem. And while it may be a pain in your butt, it's saving a lot of pain in your life.
Yeah.
Right.
Can we talk a little bit about rippling? Because I feel like that's another area where we tend to do a secondary surgery where people maybe got a saline implant 10 years ago. I think as they've aged, and you touched on a little bit, the skin changes. They maybe lose some of that nice glandular tissue they had that was covering the implant. And then now how you treat that when somebody comes in and they're super thin and fit because of Austin. And is there something they can do?
Well, I think that is one of the things inherent to saline implants in particular. It's not that we never saw it with silicone gel, but one of the good things about the saline era was that we learned that we started putting things underneath the muscle. We learned that by doing that, there was less visibility, and we also learned there was less capsule formation and contractures. What we also found, however, is that there is no muscle out laterally, and particularly, there's this expression people have now called side boob. And in particular,
Is that a hashtag thing, Megan?
That's a trend.
It's a
actually.
trend?
Mhm.
It's a good one or a bad one?
There are certain clothes that people wear specifically to show like side boob cleavage. They
Is it
say side
still
boob's
around?
like the new cleavage.
Is it like
What?
is this still a thing? Because I remember
It
like a
was-
few years ago.
yeah,
it
it was-
Have you
big
seen
a
this on
few years
Tinder
ago.
or no? It's
I mean,
A few years ago, it was
I can neither
bigger,
confirm nor deny.
or Craigslist? How about Craigslist?
Yeah, I don't do the Craigslist thing anymore. Not anymore.
Not anymore. Can we not talk about it?
I'm still
So
reeling from
tell
that.
us about this side boob. This is a thing now, or
Yeah.
do you
I
get
mean,
a lot of
yeah, it's a
requests
bit-
for side boob?
I think that, yes, I think that people want that look. Now, and just like anything, I mean, what you choose to wear can either enhance it or cover it. I mean, I would tell you that probably just as much as side boob, that under boob is probably one of those things too.
That is,
That there's
yeah.
certain tops that people definitely want that sensual look.
But under boob's a slippery slope because there's under boob and then there's down boob.
Yeah. Yes.
And there's,
yes.
and there's a
let's-
really fine line
Yeah.
between.
Yeah, we'll call it crease and lower pole. Yeah. But no, I think that getting back to your point about the saline is one of the nice things about the new silicone gel implants is that they don't ripple. And in a very thin patient, for example, where there is a thin layer between where the skin is and where the capsule starts for the implant, I mean, that sometimes is millimeters. And so it is something that by putting in a new generation silicone gel implant, you can really take away that rippling effect and give them a lot better look. The other thing about it is that the saline has a tendency to collapse a little bit, and the newer implants maintain their volume and their shape better without the expense of being hard and firm. Because in order to prevent the saline from rippling, you would overfill it. Well, everybody knows what a water balloon feels like when you put more and more water in. It becomes tense.
Right.
And that's not what a natural breast feels like.
Right.
Most women that we take care of, I mean, people don't know they have implants just feeling them. I mean, I've been told by tons of my patients that their OB-GYN was like, my God, I didn't know that implants could be this soft.
Can you confirm Dr. Hayden's statement about his patients, Gilberto?
I mean, with my own personal experience.
But
Not as a PA, but
Right.
just the bachelor
Like,
part.
yeah.
but
I
but-
confirm.
Ex-bachelor.
But when you say too that with the new gummy bear cohesive, it gives you a little bit more room to play, like you were saying earlier, in terms of sizes. Because with the salines, I feel like the threshold of going up and making somebody very coconut firm looking was very low. With the gummy bears, you get a little bit more room to play with some of those sizes.
Absolutely. And I think that the other thing is that you maintain that upper pole better with a prettier shape and not that big round, kind of fullness that looks very unnatural. Particularly, again, in somebody who's 40, 50 that has breastfed, had children, etc., they're going to start to lose some of that volume. And just with the newer implants, putting them in there really kind of helps maintain and shape that pole. Because, a lot of women, you tell them, look, you don't have to wear a bra if you don't want to. You can wear, certain dresses, tops, etc. And they're so excited about that. They've been tied, to bras their whole life. And you just tell them, look, I don't have to put a big implant in. I can put one that fits you, and I can show you what it's going to look like. And then they'll be like, that's the coolest thing.
Do you find that there's a specific time that women prefer to have this secondary breast revision done, like a time in their life or after a certain event or something?
I think most of the time it's once they figure out they're not going to have children anymore. And I think that just plastic surgery is so much more talked about, and they've got a girlfriend, they get online, they look at Megan's stuff, but I think that that's typically the deal. So I would say, kind of late 30s, early 40s is when, and that's a good question that people ask a lot of times, is like, how do I know when the right time is? Well, I think that once you have what I would call the surgical findings, meaning you come in for something and I think I can fix it, the younger you are, the better your skin's going to be, the better quality you have, and therefore the better outcome you're probably going to have, obviously hoping everything gets done right. Because, and then you get to enjoy it more. I mean, we're not talking about facelifts today, but when people come in and say, well, my mom had her facelift done when she was 70, so I'm going to get 70. I was like, why would you wait till you're 70?
Yeah.
I mean, you have such better skin when you're in your 50s, and we can do that. But getting back to the breast part, women oftentimes they're worried about having implants at a young age and whether it will affect their ability to breastfeed, the shape and size of their breasts, etc. I mean, if you're in your 20s and you have breast implants, I feel like the implant really helps maintain and preserve the shape of the breast more so than letting your body go through the normal changes without an implant, because it keeps the fullness, it keeps things kind of pushed out a little bit. And so I am very much of the mindset that if that's what you want at a younger age, there's really no reason to not do it for fear that, you'll
and like
screw
you
something up.
said, I mean, even to the point of, with clothing, that can be a very emotional thing for women. I'm sure this entire journey can be pretty emotional, but to have that confidence, feeling like you can wear whatever you want and feel good about yourself, like that shouldn't be something that you save till later in life if it's something that you want to do now.
Yeah. And I think secondary surgery, people have done their research. And so they're definitely emotionally involved. I mean, and Instagram, YouTube, all those things, Real Self, other stuff. Really, patients come in, I feel like, a different perspective. I feel like when I first started practice, people just came in and said, oh, I feel like my breasts are pointing down or something. Now they'll come in and say, oh, I want stratus. I want some mesh. I want this. And then it's our job to kind of, hey, yeah, you're a good candidate for this, or no, you're not. And I would say probably, at least a good 20% of patients that come in for breast revision, secondary something, I tell them, you actually look really, really good, and there's not much I'm going to do for you. And sometimes they just need to hear it from someone, because there's also a limit to what we can do.
Right.
Yeah, absolutely. No, I think that, like you said, it's when people come in and you have to listen to them and see what their goals are, what their objectives are, and what bothers them. And I think you're exactly right. There's, surgery can't cure everything. And patients will be very disappointed if you do a surgery and that they're not going to get the outcome they wanted. And then that's that's the difference between an explanation at the beginning before the surgery and what we would refer to as an excuse after the surgery.
And being transparent, I feel like, can kind of cancel a lot of that out.
Totally.
What about from an anesthesia perspective? Do you guys do anything different for this type? And I know this is an all-encompassing term, but do you treat this differently than you would a breast dog?
Since you pointed out before, I am a one-trick pony. I didn't forget that. Anyway, no, actually, when patients come in for a secondary or revision, it's nice because I can ask that patient how their experience was the first time. Did you have nausea afterwards? How was your pain? How did you tolerate it? How were the next couple of days after surgery? How was your recovery? Those things, I start to clue in on things that they say, oh, I was nauseous. Oh, I had pain here. I had pain there. Do an education at that point. If it was pressure, or if it was really pain, did they have, huge implants in a very tiny patient when they had it first done. Those are all things that I listen out for. And then we always try to do like low narcotic techniques, new stuff that's trying to reduce our amount of opioids that we're using on these patients to reduce side effects and nausea profile and everything. So it's nice because it gives me a little bit of a baseline.
I think it's interesting that the low narcotic stuff has really become a huge push for all of us. And then in terms of recovery, I know this is a broad question because depending on what they have done, but I feel like sometimes in my patients, the breast revision surgeries, the recovery, not in terms of discomfort, because I actually feel that like in terms of pain, it's less when they've already had an implant under the muscle and we switch them out. But sometimes if we do some type of capsulorrhaphy or internal bra or put some mesh, I do tend to limit some of their activity a little longer to let that stuff sit. Is that
No, I think
what do you
that,
typically do?
yeah, I think that's a good point. I think that when you're revising something, then it's indicative that there was something that happened and stretched, et cetera. So you've got to give that a little more time to heal. And so, yeah, I probably would be more on the 3 to 4 week side instead of a 2 week, side in terms of when I would, let somebody go back to activity. I think though, speaking to the anesthesia part of it, I'm much more aggressive to recommend using Exparel during that surgery, because Exparel is a long-acting local anesthetic, and you guys have talked about it on the podcast before, but for those who don't really understand it, so the dentist uses something called lidocaine. Typically, lidocaine is something that will last for a few hours. Exparel is a long-acting local anesthetic, and it will last for, we'll say, 3 to 5 days. But I think the importance of Exparel is that you've got to put it precisely where it's going to help. You've got to do it as an intercostal block. You've got to do it sort of in the thoracic bundle, and then you've got to do it sort of along that serratus edge, and then where your incisions are going to be. If you just squirt it in the pocket or haphazardly, put it in the subcutaneous tissue, it's not effective. But if you precisely inject it, then those patients really get a lot of relief and have to take a lot less narcotics, because to your point, when patients have a bad experience with nausea, they're scared to death about taking medication. And if you can reduce the amount of narcotic, not only might they not have nausea, but they're not going to have constipation, and they're not going to have those issues that every narcotic has. It's just some patients are just more sensitive to it.
And are there certain things that patients should be kind of worried about or nervous about as far as safety goes when having a revision?
Biggest risk of having any surgery is bleeding and infection. Those risks are, 2 to 5%. So those are very low. I think that as long as patients, follow the directions, they don't try to do too much. Again, typically my patient is the mom who, I have to say, look, you can't be super mom. You're not going to be able to drive carpool for probably 7 to 10 days. You got to have somebody to go to the grocery store for you, for probably that first week or so. But, as long as they don't try to rearrange all of the closets while they're, at their downtime, or as long as they're not, trying to, rearrange the pantry, et cetera, then I think most patients have a good outcome. But I do feel like you've got to really, make sure that you protect, like you were saying, Johnny, you've got to protect your repair, because there's a reason you're repairing it.
Right.
Is there any kind of top 3 take-home points you'd like to send to people before we do a little one of my favorite sections called Fact or Fiction, which we're going to? Your office staff was kind enough to send us a few questions for you.
Thanks. My take-home is you obviously go see a board-certified plastic surgeon. I think you have realistic expectations. When I have conversations with people about implants, I'm almost scientific to a fault when I'm explaining diameters and why I choose certain implants, because I really want that patient to understand why I've chosen that size for them and why I feel like this is not only a short-term but a long-term commitment. And I want to set them up for a great result, and I want to have a low revision rate so that, again, they're not, coming in every 5 to 10 years to fix something.
I think those are great points, because breast revision especially, you need somebody that's going to take you through that journey, and sometimes it's a process. It can be a real journey.
It's so much easier to do it right the first time. And like you were pointing out, the revisions that I do, not usually your patients, Johnny. They're fortunately not my patients. They're other people's patients, but it's not necessarily because something was done wrong. It's just because that patient has aged, their body has changed, and we want to do as many things on the front end to reduce that.
I love it. I hope today's been helpful because I feel like there's a lot of people out there that maybe don't know where to go or when to go, and so I think we hit on some good stuff. So,
I feel like I learned a lot.
Yeah.
boom, that's what I'm
Yeah.
talking about. You
Yeah.
sound very pensive today.
I know.
You did.
Yeah.
But let's
Side
do a
boob
little
and-
fact or fiction, and if you guys have any questions for Dr. Hayden, please jump in. But we'll jump into a few fact or fiction. You only listen to Texas country in your OR room for 14 hours a day, 3 days a week.
That is fact. I'm a
Wow.
big Texas country guy, and so I really enjoy Parker McCollum, Cody Johnson, Cody Jinks, those guys.
Because Travis has told me when you have these marathon surgery days, because obviously you're a very popular surgeon here in town, that there's only so many Texas country artists, and so you may recycle a few over the 14 hours.
I know all the words. I can tell you
I
that.
can attest to this.
Yeah.
A couple marathon days.
So we'll switch it up, and sometimes it will be non-Texas country, but
Okay.
it's still country.
Still
country.
It's
Okay.
still country.
And then fact or fiction that you've had one pair of boots that are your like lucky surgery boots.
That is true. When I was a surgery, I was in college. And then when I was a surgery resident, they had gotten so worn out that one of my surgery staff told my wife that he thought my boots were HIV positive. So she immediately went to the Red Wing store and bought me a brand new pair. So that would have been like 1995. And I still wear that pair every day when I operate.
I feel like once you get your system, it's hard. Fact or fiction, this is general. Surgeons don't like change. When we have a system,
I
it just
can
like
100% attest to that.
I am
fact.
I am the most easygoing person at the surgery center, but I do not like change. I mean, they're like, "Can we use this or that one?" I'm like, "Yeah, sure." And they're like, "Well, what if we do that?" I'm like, "No, come on, we don't do that."
I feel like that's a fact or fiction for Travis. That,
Oh, for
that
sure.
Dr. Hayden is the most easygoing.
Oh, he is very.
I
easy.
get reminded that by the nurses and techs all the time. how much Dr. Hayden is
Dr.
more.
Franco, you know how laid back Dr.
I feel like I'm told that on a daily basis.
Maybe.
Well, Dr. Hayden, I appreciate you answering a few questions for us. Can we put you on the fire one more time? We do something called Behind the Bovie, and so I don't think I gave you a heads up on this, but if there's something you could tell people that happens in the operating room or in a surgery consult or anything in kind of a behind-the-scenes look that people probably don't know that we do to either help prepare them or to make the surgery a success.
I think the markings are probably things that people don't understand.
Mm.
And so I really try to be specific with patients as to, for example, how high I'm going to lift the breast. When we do a breast lift, sometimes people think it's just the nipple we're lifting, but really you're lifting the entire breast. And so I'll put the marks on or I'll explain to them during the consult what I'm going to do. And then the day of the surgery, I'll let them know, look, I'm going to do all these markings with you. And I draw on my monitor during the consult where the markings will be. But I tell them the day of the surgery, I'm going to do these markings with you, on you, and you'll have every opportunity to ask questions. So I think that's helpful.
That's kind of cool. Maybe one of these days on the IG we'll actually do some live marketing stuff because I don't think people realize how much of a we always say plastic surgery is an art, but wouldn't you agree that there's a lot of like math and science and very specific? I mean, I actually will take my ruler and level in there sometimes because I think if you're not off from the very beginning, the old saying of measure twice, cut once couldn't be any more true for breast surgery.
I agree. It is a little disconcerting sometimes when you do bring the level out and just to try to get patients to understand like their inframemory folds and their creases are really like 2 centimeters off. And that's what you're trying to do is you're trying to make it perfect.
Mm-hmm. And there's only so many things we can control.
Right.
And in the end, can we do a little quote of the day? And I think there's a quote off going between Gilberto and Travis. There was something there that Gilberto didn't love the fact that Travis took his quote last time. And so I heard a rumor that you may take this section away from Travis today.
I've got some quotes.
Oh, just happened to have some.
I happen to have some.
That's right. I'm just the one trick pony.
Could we do that?
Yeah, let's give us a
All
quote
right.
here, and then maybe we could see how this applies to Dr. Hayden in his life and practice.
I think this one would apply really well since
Seems like you have a plethora of them there.
You came prepared.
Yeah. No, just given the fact that you guys go through so much training and everything. I like this one by Steve Jobs. It says, if you really look closely, most overnight successes took a long time.
Boom.
Yeah.
I really like that. I mean,
Yeah.
Go ahead
Well, I
and
was
get
gonna
first
say,
crack at this.
There's a Jim Collins wrote a book called Good to Great, and he talks about companies that that transition from competing at a market level to being, 3 to 15 times market level. And there's not one event, technology or otherwise, that put them there. And I think, like you said with us, we have so much training and we learn the techniques and we have those tools so that when a particular patient comes in with a particular finding, we now know how to address that. But we may not have ever done that particular case, but we have the background and the knowledge to safely do it.
I absolutely love it because I think people think that, oh, even though someone's so young or there's something's happening, like they don't realize how much goes in the background. And you can talk about this all the way back to shadowing, residency, med school, all sorts of training. I think you were at UT Southwestern, which is probably considered one of the maybe to say in a nice way, one of the most difficult residencies in the United States. Is that fair?
I think that's fair.
But I don't think people realize how much stuff goes into things before like it actually comes in. I'm sure the blue check mark didn't come easy. You've been working on this for a long time.
I mean, I think that just applies to success in all ways. I mean, people oftentimes see that you have success, but maybe they don't take the time to think about what it took to actually get there and all the steps you had to make.
I think also we live in this social media, Instagrammable, world right now where everybody's only taking pictures of things they accomplish or things that go well or things that go great, but they're not taking pictures of the sleepless nights, the studying, the missing parties, the missing birthdays, all of that.
The going to bed at 9 o'clock to be there at 5 a.m. for Dr. Hayden's cases?
Exactly.
Okay.
And even kind of bringing that back to like an instant gratification idea, which again also kind of applies to social media. I think with surgery too, people maybe see these looks that they want to have and they don't think about maybe you have to have a revision, you have to go through a journey to get there, and it is a process. But once you heal up, you'll probably look great and be happy with it.
I'm going to go out on a limb and say this may be the best quote we've had. I'm not trying to throw the
We have a
gauntlet
lot of-
down for one, Travis, and say you may need to bring
It
the
applies
thunder
to
on
many
the
things.
next cast, but
I mean, I've got some
damn,
others.
That's a
Oh,
good one.
that's on fire
I've got others.
in
So,
there.
I don't know.
Devoted.
I like this
Well-
section of the show. I don't know. Maybe.
Well, I think we're just about out of time, but I definitely want to spend a special thank you to Dr. Scott Hayden for joining us, taking time out of his life to come join us. And I know they can follow you on your Instagram at Dr. Hayden. And you film a lot of surgeries. You also do some stuff for your med spa, covering over some other things as well on your Instagram.
Absolutely.
And then what's your website if people want to check stuff out?
It's just drhayden.com. It's HAYDON.
Perfect.
drhayden.com.
Well, we're obviously going to be covering some more topics in the near future, but I want to thank all of you guys for listening. Stay tuned. We're going to do some more med spa stuff. We have some injectable things coming up in some future episodes. I also wanted to ask all of you, if you like our cast, tell people about it. You can download it on iTunes. You can download it anywhere where you get your favorite podcast. So please subscribe. Please pass it on to somebody. We would greatly appreciate it. And thank you again to producer Donald, i.e. Tall Gamer, for keeping us moving and helping us. So thank you guys. Appreciate it.
Thank you.
Thank you.